Anesthesiologists have been using neuromuscular blocking agents for a very long time. About 2 centuries ago, Claude Bernard described that the neuromuscular junction exists and stimulation of a nerve causes the contraction of a muscle. After that, the description of the neuromuscular blocking agents has heralded an onset of a new era in surgery. Various types of surgeries which were possibly thought as undoable earlier on were done. Thoracic surgery, neurosurgery, ophthalmic surgery became possible. It is very important to keep adequate depth of neuromuscular block during surgery. It is true that very deep levels of neuromuscular blocking may not be required for all surgeries. However, it may still be required in neurosurgery and ophthalmic surgery. It is very important to maintain the adequate level of neuromuscular block because we do not want the patient to move during surgery, nor do we want the patient to remain paralyzed after surgery. It is a common knowledge that up to 85% of neuromuscular blockade is required to produce surgical anesthesia. It is also known that 95% of block is required for most of the surgeries except ophthalmic and neurosurgeries. So we have a narrow therapeutic window of 85 to 95% of neuromuscular block that has to be maintained during surgery. Levels deeper than that will cause undue delay in the recovery of the patients. Levels which are not up to 75 to 85% will not produce surgical muscle relaxation, and this hinders the surgery. Considering the narrow therapeutic window of 85 to 95% of neuromuscular block that is required, it is surprising that most of the anesthetics are carried out without neuromuscular blockade monitoring. It is extremely important to monitor the neuromuscular block like we monitor the heart, respiratory system, brain and the depth of anesthesia during a routine anesthetic. By monitoring, we can assure that adequate depth of anesthesia can be provided, adequate muscle relaxation can be provided during the surgery, and the patient will recover well soon after the surgery. If this is not done, either the intraoperative conditions will not be satisfactory or the postoperative recovery of the patient will not be satisfactory. This video is an attempt to show the parts of the monitor and to show the videos of various types of blocks, the depolarizing and the non-depolarizing, the deep block and the recovery of the patient from it, and the postoperative pattern of the nerve stimulation. I sincerely hope that this video helps you in enhancing your knowledge.